I'm over here looking hurt, but the show must go on. The show must go on. Anyways, what's going on, beautiful people? Welcome back to my channel. It's been a while since my last video. I mean, it's been under a week, or it's been a week, but like, nevertheless, it's been a little bit. So today's video, I'm gonna be answering more of your questions, and I'm gonna be answering them, and it's just a lot of questions you guys asked. So I'm just gonna dive straight into it. I'm diving straight into this. Okay. Like I said before, or how I mentioned before in on my Instagram story, I have also answered some of these on my Instagram, and here I am talking more in depth about the answers on this video. So if you hear something kind of repetitive, that's why. Anywho, how bad is the scarring? Doom, doom, doom. Doom, 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 doom. That's how bad, or how different, yeah, that's it. How long does it officially take to heal? The process is extremely personal and unique per person, so what could take someone 7 months could take someone more so 4 months, or you know, anything in that range in between, or longer, shorter, whatever. But like the results of like the general results that most people will see of it looking complete or finished, or you know, the best of the best type of results that you're gonna kind of get is anywhere between 6 months to a year is like the finalized results. Do you feel different? Like, was there an immediate life-changing feeling when you woke up? Not immediately. Immediately, I was just tired. You know, just had surgery. I was just for a little bit. But now, since I've had time to reflect, and because I'm 6 weeks post-op, I had time to reflect and really compare the differences. Pretty solid. You can definitely like, my whole morning routine is different. I don't gotta like throw a binder on real quick and then like, you know, shimmy into like all that extra stuff, and don't have to debate whether or not I should wear certain things, because like, I don't know, like my chest is too big or anything like that. I don't have to go through that anymore. Just throw that bad boy on. If it don't look right, it's because I'm not looking right. You fit? But yeah. So overall, just a lot more confident in the things that I choose to wear, and knowing that, yeah, just feeling a lot more confident in things that I choose to wear, and that I now have control on the things that I like to wear. What has been the hardest part? Patience. Like, understanding that you're not gonna be able to do the things you like to do immediately, or not anytime soon, really. Because immediately I was like, I felt so like helpless, hopeless, whatever, when I wanted to just like, when I first got out and I was laying on that bed in my bed at home, and I wanted to just pick up a drink beside me. I couldn't reach over to pick up the damn drink. even with my other arm that was closest to the drink, I wasn't even able to like go like this to get it. Like no extension of the arm, no nothing, no nothing. So I was just like, damn, I really gotta go call somebody to come pick up this drink just so I could sip it for like 2 seconds. And then like we're talking about from ground zero to now, you would slowly be able to regain the ability to do certain things, but you always want to jump ahead, but you're really grounded because you just can't. Like, it took a while for me to just be able to shower fully, you know, clean every type of crevice I had, or just put on lotion or anything like that. Put on my do-rag. That took like 4 weeks in to be able to be clear enough to move my hands above my head and all that. Wasn't even able to put this bonnet on. Like simple everyday things that we take for granted, wasn't able to do. So that was very annoying, but I'm actually really glad for the experience, because we take these little everyday things like for granted. Like you don't even know unless you really have to go through it. Like I could not wipe my bare ass. Just couldn't. I was like literally going like this. Like I was like, and then I'd be stuck because I can't move up. I can't do nothing. It was so rough. It was rough in these streets. And then waiting every week to be cleared for certain things, and majority of the time, personally, because I was really lucky, I felt like really good majority of the time. So like I felt like I should be doing everything 2 weeks post-op, but then they'd be like, no, you gotta wait 6 weeks post-op for this, or 4 weeks, 5 weeks, etc., etc. So patience was very much the hardest part. How much did your top surgery cost? Your college tuition. How do you feel now? A lot more confident. I feel so much better about myself personally. I have a better mind to body connection. Overall, just a lot of positive things. I was very worried about my scars and things like that, treatments, and I was just very worried. I didn't want myself to look jacked up after spending like a lot of money and going through all this weight and patience and stuff like that. So I'm really glad for the results that I have. So I feel really good, very happy with that. Were you nervous to get top surgery? No, I was not nervous. I treated the day just like it was any other day. Everyone was really like, bro, is you good? Like, we don't know this is you putting on a facade or anything like that. No, I was just chilling. Like, even if you watch the video, if I just pump that right there, like, throughout the day, I was just like, yeah, it's happening. Like, I'm gonna wake up and then it's gonna be all good. Like, there's no difference in the day. But I think it was more like mentally, rather than like, I developed myself mentally, going through different stages of emotions more than I was able to convey it physically. So, yeah. Are you fully comfortable wearing no shirt outside now? By the way, I love you. I love you too. This is New England weather. It's raining every 2 seconds and sunny the other 5. So I'm not really walking outside shirtless. Nor do I really feel the need to. I kind of find that stuff obnoxious. You know, I'm not even gonna lie about that. The top surgery piece was more so for myself. I'm not the type to just be like, oh, let me just walk out into, you know, out and about, going all over the place like that. But when the time's right and if there's a need for me to do it, I'm gonna do it. Like, I mean, outside, that's for like the outside part. But like, if I was to be going to the beach, I would think so. When I'm going to take a shower and I don't have to like wear a towel over the top, I definitely feel like so comfortable and so much better. Why did you want keyhole? I wanted keyhole because it is cheaper and it's it's cleaner. Like, you don't see there's no scarring like that's visible, because it's literally like they take the nipple and they pull the tissue out, so it's quicker. The recovery process quicker as well. Like cheaper, quicker. No scarring. Like, there's so many benefits. Of course, it has its like disadvantages as well. But like, I was able to look. I wanted to look over those and stuff, but I did not fit the breast cup requirement really. Cause let me draw this out so you know what I'm talking about. Cause I'm saying breast cup requirement, y'all probably like breast cup what? Breast cup who? Breast cup. When? Okay. So like, boo. Ooh. Okay, so I'm trying to draw this so you can see. Okay, so imagine it's the chest, then this the booby, and that's the stomach. I'm gonna put some. That's the six pack right there. Yeah. Oh, this is not looking right. So yeah, that's the six pack. That's the booby. Let me put a nipple so you can see. All right. Oh, and then this is the other booby. Okay, I think I did this nicely. So you got two types. You got a type where it's kind of more perkier and like, yeah, and you got one that kind of has more hang time. You feel me? These ones are easier for keyhole because literally they take the tissue right here and suck it right out, or they take it right out. This one, since it has the extra hang time and got that little loop on it or whatever, not loop, excuse me, like that extra piece or whatever, that's your skin. That's your skin. Sorry, that's your skin. So when they're like putting the skin, like, cause they can just easily zoop and then like put the nipple on top, or the nipple stays on, or whatever, the nipple. But the other one, since you got extra skin, you got that excess skin. So they're like, what are we supposed to do with this? That's why it's harder for those that have bigger chests. Whoa, man. That's saved by me. Harder for those with bigger chests. My chest didn't exactly perk out like that. It like just like my right side it did, but my left side, as you guys know, my thing was lopsided. So thanks to my left side, thank you, it like just drooped down just a little too much, and it was like, this side's not gonna come out looking right, so double incision's best for you. So I was like, oh, great. After both surgeries, will you still have to take testosterone? Might be a dumb question, I don't know. Not a dumb question, valid question. Yes, testosterone is a forever taking hormone replacement therapy treatment. Like, there's different ways to take testosterone. They got gels, patches, injections, etc., which take different like time increments into when you need to take them. So if you are planning on taking them and you feel like, I don't know, the gel is, because I think that gel is everyday thing, or the patch, I forget which one, and if you think that's too much, too tedious or whatever, I don't know, then you might want to do the injections, which is which is every week, or, you know, it depends on who you are as a person and what you're taking, but it's a forever thing, you know, because you have to keep, like, your body's always producing hormones. So if your body does not produce enough of the desired hormone, then you need to take these supplements to give you that pump, that necessity. Was it scary for you? Like, how did you feel after it? Any pain? Did they put you on any medication? Put me on medication. Well, gave me medication. Did not use the medication. Didn't need the medication because I didn't feel any pain after it. Just a lot of discomfort. Because, you know, it's a new feeling, new sensations, and regaining sensations, etc., etc. So, nothing in that sort, really. Just scary. Not at all. I'm really more so, like, I'm really the person that's, like, however this goes, I'm just gonna have to deal with it regardless. Like, like, if I get screwed, I get screwed. But I have a lot of faith in the doctors in Boston, because you guys know we have the best doctors. So I have a lot of faith in the Boston medical team. And I knew God got me, and He wouldn't screw me over like this. So, how do you care for the scars? I'm actually gonna be making a video about that. Many different people do many different ways on how they care for the scars. My scar care is a little bit different from most, so stay tuned for that. Did you have a big chest before? No, I didn't. You can see my other video to see the before and after pictures. I'll put that right there. When the stitches heal, will it look more like a chest, or will it look like stitches across? It depends on the stitching that the doctor uses. I have dissolving stitches, so you're not going to see the stitches visibly at all because it dissolved off. I believe that's how it goes. So you just see the scars. So it will look more like a chest, but again, that's kind of subjective because there's so many different types of chests and people are so different, whatever. So yeah, but it also depends on how well you take care, or how well your body naturally take care of your wounds, chest, scars, etc. And so yeah, the hope is for it to look like just like any regular chest, you know. Was there like a certain amount of time you had? Was there like a certain amount of time you had to wait to get it, and for what reasons? Yes, because I originally had because I originally had an insurance plan, right? But my mother was in the process of switching it to another. Couldn't tell you why. Well, good enough reason why. And then when she switched over, we had realized, well, I already figured that out, but she had realized that insurance wasn't gonna cover like nothing. It wasn't covering nothing in terms of the surgery. So we had to switch again. So we switched again, and luckily that, like, coming in clutch before the consultation, that insurance was approved. So we had that couple months period where we had to like figure that out. Excuse me. And also the time period before, like, we made the consultation before the whole insurance thing, of just figuring out scheduling for the consultation. And then when we had the consultation, you had to schedule for the surgery. So it's very like, once you do this, then you so it just said I exceeded thingy because I forgot to delete the old videos off his memory card. So, and I completely forgot what I said last. So I'm just gonna wrap things up here. Thank you guys for watching. Make sure to like, comment, and subscribe. Follow me on social media. Watch my other videos. We're so close to 2K. Listen, come on, guys. Subscribe. Get your friends, your sister, your brother, your mother, your auntie, your uncle, your father, your grandmother, your grandfather, friends. Get your dog, get your cat, get your rat. Rat. Yeah.